Hi, I'm Dr. Matt Sheehan, Medford Family Chiropractic Center, Medford, Oregon. And I'm here today to show you two of my favorite wall stretches that I show to all my new patients. And the reason I use these two stretches is because I've noticed over the years that on average they will free up or reduce about 80% of the stuck spots, or as we as chiropractors say, the subluxations, or the bones out of place or the stuck joints that we experience in the mid-back and the low back, and sometimes even in the neck and the pelvis. And how they do this, in a nutshell, is by releasing the majority of muscular tension and spasm in both the mid-back and the low back. So here's the very first one. First of all, I have people stand a comfortable distance from the wall, on average about a foot away. Next, you end up putting your forearms on the wall, straight out from your body. You're looking straight ahead, and this is your starting position. You want your feet about hip width apart, your arms about shoulder width apart, and you're going to slowly slide your arms, keeping your forearms on the wall. Slide your arms up the wall slowly until you start to feel a stretch. And I emphasize the start of a stretch, not a severe stretch. Start of a stretch, and at that point, and it also doesn't matter where you feel the stretch. Also, if you are experiencing a little bit of pain as you're doing it, that's okay. Most of the time, it's just going to be a little tight muscle that's starting to stretch, and it's not going to cause any further injury. But if you feel more than a little stretch, I always tell my patients back the stretch down until that pain drops to a real minimal level, and start there. All right. So from here, let's say I start to feel a stretch right here. What I'm going to do then is I'm going to gently push my forearms against the wall. So I'm pushing, and I'm only pushing hard enough to feel my muscles just starting to engage or starting to work. And wherever you start to feel that is fine. Automatically, I'm going to start to feel it in my abdominals as they're bracing, and I'll feel it in my shoulders and my arms typically. So I push just hard enough to feel that, and then I start counting to 6 slowly. So I'm counting 1, 1,000, 2, 1,000, up to 6. As I'm counting, I continue to breathe, and I continue to look straight ahead. So I'm pushing, I'm breathing, and I'm counting. And I'm breathing abdominally. I'm letting my belly stick out as I breathe in, so it's like this. Just normal breaths, but in and out in the abdomen, not up in the chest, up like this. So breathe like that. And when you get to 6, then what you do is you leave your arms where they are, but you quit pushing. And now what you're going to do is you're going to take a deep breath all the way in, and as you breathe out, you're going to choose to relax every muscle in your body as much as you can, except the arm muscles that are holding your arms up. So you're going to let yourself become essentially a limp rag. And you're going to feel all the stress, all the tension, and the pain that you've been holding draining out your feet, so to speak. So just visualize that and feel it. So watch. It's like this. Just let yourself go limp. And you may, as you relax that completely, you may find you're in a not so stable a place with your feet. So you might want to move back a little, or move forward a little, or spread your gait a little bit. That's all fine. So when you breathe out once, then that's one cycle. Now you're going to repeat 2 more times. So you're going to do it 3 times total. So to repeat, we're going to slide our arms up from there until again I start to feel a stretch. And then I'm going to repeat. So sometimes the mistake people will make is they're too loose, and they allow themselves to do this, where they're arching their back like this, or like this. Try and keep more like a plank, where you have a slight curve in the small of your back, but you're not arching too much. Okay, so you slide the arms up until again you start to feel a stretch, and then you're looking straight ahead, and then you re-engage. You push, counting to 6, 1, 1,000, 2, 1,000. Keep breathing till you get to 6. Relax. Keep your arms where they are. Quit pushing. Deep breath in and out. Then you'll just let all the tension drain out your body again. And then you repeat. Slide your arms up a 3rd time. And as you go higher, you may want to get closer to the wall. maybe more comfortable. Slide up again till you feel a stretch. And anywhere along in there, if you start to develop pain that's more than a little, again, you're going to drop your arms until that pain goes away or becomes minimal. And then again, you're going to push. Another 6 seconds at 1, 1,000, 2, 1,000, up to 6. Deep breath in and out. Letting yourself completely relax. And then you drop your arms. So that's the end of the first one. I don't have a name for that one, sorry.